In other news now, Lagos State AIDS Control Agency has flagged off its campaign against the stigmatization of persons living with HIV. The agency says those who refuse to desist from the act will be fined or prosecuted. Senior correspondent Jacqueline Ogo has more.
That signifies the flag-off of the campaign against the stigmatization of persons living with HIV in Lagos State. This was at Ikeja Local Government Council area. The same was done in Alimosho. Lagos State AIDS Control Agency says the penalty for stigmatization is to be reviewed upward and there will be prosecution where necessary if cases are reported.
The previous fines we are looking at 50,000 naira, 100,000 naira thereabout, but we are actually reviewing the fine now. So I will advise the general public to reach out to Lagos State AIDS Control Agency and probably lay their complaint, and we are going to fight the case.
The Director General of the National AIDS Control Agency, who was represented, says the campaign against stigmatization will be intensive.
This act has been signed into law, a constitutional document to fight stigma and discrimination across MDAs, work environment, markets, and everywhere.
The coordinator of the network of people living with HIV and AIDS in Nigeria gave an important hint.
If we must end AIDS, then we must first end stigma, because stigma drives the epidemic. A lot of people will not want to come out because they are afraid of being stigmatized.
Partners on public enlightenment also gave some guide.
HIV is not a death sentence, and good enough, as of today, science has proven that people can live a normal life, they can live healthy, they can live long, they can attain their maximum potential.
A lot of people feel that they don't need to, get close to them, because they feel that once they get close to them, they can be infected. But you can't be infected unless maybe you share the sharp object or you have a sexual intercourse with people living with HIV.
Statistics have it that between 1.9 and 2 million persons are living with HIV in Nigeria. If these persons living with the virus refuse to take their medications, and people who do not know their status do not go out to have the test done, clearly the United Nations target of eradicating HIV by the year 2030 cannot be achieved. Jacqueline Ogo, TVC News, Lagos.